Hello, my name is Lindsay, and I'm a junior nursing student at the University of North Carolina at Pembroke. And today I'm going to be discussing flu vaccines in teenagers ages 13 to 18. So if that applies to you, just keep listening to find out more information. First, I'm going to tell you a little bit about the flu, and then I'll discuss flu season, common side effects that can happen when you get vaccinated, along with some common myths about the flu vaccine. Then finally, we're going to talk about ways to protect yourself and others from the flu. Influenza is also called the flu, and it's a contagious respiratory illness that affects the nose, throat, and sometimes the lungs. There are actually two types, influenza A and B. In the US, there are two ways that you can get a flu vaccine, the shot or the nasal spray. The shot doesn't contain the live virus, which means it is inactivated or a killed version of the virus. And the nasal spray does contain a weakened version of the live virus, but it doesn't mean that it will cause you to get the flu after receiving it. Flu season happens in the fall and winter, and the peak time for the flu is usually December and February. It takes about 2 weeks for the vaccine to provide protection from the flu, so the CDC recommends that you get the flu vaccine by the end of October so you'll be protected throughout the flu season. Getting vaccinated can help protect not only you, but the people around you, like babies, the elderly, and people with serious illnesses. Common side effects of the flu shot can be soreness, redness, a swollen arm where they injected the vaccine, fever, muscle aches, headache, and fatigue. You shouldn't get the flu shot if you are severely allergic to eggs, gelatin, antibiotics, or have ever had an allergic reaction to the flu vaccine in the past. You should speak to your doctor or healthcare provider before receiving the vaccine if you have an allergy to any of the ingredients in the vaccine or if you ever had Guillain-Barré syndrome. People who are sick or severely sick should wait until they recover to get the vaccine. Side effects from the nasal spray can include runny nose, fever, headache, vomiting, muscle aches, or low-grade fever. You shouldn't get the vaccine if you've ever had a severe reaction to the nasal spray or any of its ingredients, including eggs, or if you have a weakened immune system. You should speak to your doctor or healthcare provider if you have asthma, if you're sick with or without a fever, and if you've ever had Guillain-Barré syndrome after a previous immunization. Teens with egg allergies should be vaccinated in a doctor's office or a hospital as opposed to CVS or Walgreens like a lot of people do, so that they can be monitored for severe allergic reactions. After speaking with some teens, I realized that there were some common misconceptions surrounding the flu vaccine. One being the flu vaccine will give you the flu. So to answer this question, can the flu vaccine give you the flu? No, because they don't give you the live virus. They're giving you an inactivated or a killed version of the virus or a weakened version of the virus. So it's not actually strong enough to infect you. And another one was, do I really need to get a vaccine every year? And the answer to this is yes. The effects of the vaccine don't last forever, so we should get one each year to keep ourselves and others protected from the flu. Also, the virus is always changing, so the vaccine has to be updated to keep you protected. Most of the teens I talk to understand the importance of getting the flu vaccine because it keeps them and their families safe. So I found a poster just to remind you of 3 actions you can take to fight the flu. The flu is very contagious and can be very serious or life-threatening in certain people. So you want to make sure you do whatever you can to keep yourself and those around you protected. First off, get vaccinated. It'll help you stay safe throughout the year, throughout the flu season. 2, you can stop the spread by washing your hands with soap and water and covering your mouth and nose when you sneeze or cough, and also avoid touching your eyes, nose, and mouth. You can also talk to your doctor about antiviral drugs, which is what you can take when you are infected with the flu. These drugs will shorten the time that you have the flu and also make your symptoms not as severe. So the sooner you can get rid of the flu, the better off you will be, and the better off the people around you will be because they have a lesser chance of getting the flu. So those were just some ways to protect yourself from the flu. But just to reiterate and go over it again, you always want to cover your nose and mouth when you cough and sneeze. And make sure you wash your hands for at least 20 seconds using warm water and soap. And a little trick I found is you can sing the happy birthday song twice, or you can find a song that you like, maybe the chorus, and sing it twice, depending on how long it is. But if you sing it twice, you'll definitely be covered and your hands will be clean. So that's the easiest way to do it. You can use whatever song you like. Another thing to do is avoid touching your eyes, nose, and mouth. And to make sure you wear your mask correctly. Now, this is a big thing, especially nowadays with COVID-19. We want to make sure we know how to wear this mask the right way. So we're definitely not going to wear it like this. We're not going to wear it like this. This is a common one we see. And we're not going to wear it like this because this isn't doing anything. So you want to make sure you have your mouth and your nose covered when you're out in public or in close spaces with other people. That's the best way to keep yourself protected and those around you protected. And also, another tip is make sure you don't share a mask. So I know your friend might need a mask and you might have one sitting around, but unless it's like a disposable mask that you can just throw away and it's for one-time use, I would not recommend giving your mask to your friend for them to use and then give back to you, because that will be just their germs on top of your germs. And I know you want to be nice and protect your friends, but there's other ways to do it. Just keep maybe some disposable masks on hand, and those are the easiest ones to use because you just use them once and throw them away, and you know it's not building up bacteria. Also, with these masks, make sure that you wash them often. Daily would be great, but I know some people don't want to wash their mask every day, but just try to wash them as much as you can. It's just to keep yourself safe and those around you. You don't want to bring anything home that could affect your family or cause them to be sick. So just do whatever you can to try to keep them safe and yourself. And thank you for listening, and I hope you learned something. And stay safe, wash your hands, and have a great day. Thank you.